Okay, this is the fourth session that we've done for uh, multiple myeloma. Buddy Haynes is a patient with that diagnosis. When was the diagnosis done? When did they tell you you had multiple myeloma?
It's been about 2.5 years ago.
Okay. Uh-huh. And what's been happening? Do you have any ideas?
Well, I've been going to the doctor or to the
Yeah.
lab every month,
Uh-huh.
and then getting the urine specimen and the blood work,
Yeah.
and then I go to the doctor, and he looks at me and says, this is simmering
Uh-huh.
myeloma,
Okay.
and he says that to come back and he gave me some numbers I can't remember.
Yeah.
And then he says to come back and give me an appointment for the next month, a week before.
Uh-huh.
I have to go into the lab and go through the lab thing and the urine thing.
Yes, because they check the proteins in the urine, which, by the way, they've been decreasing. You know, they were very high. Now they have been diminishing.
Yes.
And the bone marrow biopsy, you've done 3 bone marrow biopsies.
Right.
And they've been what?
They've not been any change at all.
Uh-huh. So they've been stable.
They're stable, and I think they've decreased, but he
Yes.
haven't had the paperwork
To really confirm that.
confirm it.
The oncologist is very optimistic about that, isn't it? About the way you're doing.
Yes,
You can say it.
he hasn't given me any medication or any ideas of medication.
Uh-huh.
And he said that if they had started with the treatments,
Yeah.
that I probably wouldn't be with them today. And,
All right. So that it's good not to do anything for this kind of a problem with the treatment that we've been doing. That's great. Mm-hmm.
he's strung out the test from the month, every month to this last one was over 2 months, and it'll be 3 months before I
To do it again. So he's been like postponing the times that you have to do the testings.
Right.
Like now you're doing it every 3 months. And how are you doing it in general? What's your life about?
It's great. Absolutely great, and blows everybody's mind.
Yeah.
That I'm 80 years old, and I still ride a motorcycle, and I still do work every day.
You work in a park, isn't it?
In RV.
An RV park?
Yeah, RV park. And
how many hours a day you work?
I usually put in about 10 hours a day.
Okay.
And lately I've been dropping off Sundays and kind of taking the whole day off.
Okay, just Sundays. The rest of the week you're doing a lot of...
About 6:30, and it's sometimes 6:30 or later when I get through during the day.
Okay, yeah, and you do a lot of maintenance work over there, isn't it?
Maintenance work, yes.
Very good. So nothing stops you. That's the good thing about it. All right. You do have some aches and pains in your hands, but that's because of arthritis in your hands.
Yes, I've got plenty of that. And I usually.
But they are very functional. Your hands are very, they don't. There's no limitations in your range of motion in your hands. And of course, you're riding a motorcycle, so you're pretty functional.
And I'd be flying an airplane if I could afford it.
Yeah, because you're a pilot, so
yes.
Very good. Are you still having your license or not? Not your license is not active yet, or
they just I have to get a physical every 2 years.
Okay.
And I'm ready for another physical, but the last one has no change. No. The doctor thought I was lying to him because I didn't take any medicine. And but no trouble passing it.
Oh, that's wonderful. Very good.
And I don't wear glasses.
Yep.
And
And your hearing is very, very good. So that's very good. All your biological signs of aging are very, very good. Very functional. And 80 years old, isn't it?
80 years old, last September.
All right. Wonderful. Very good. Well, thank you very much.
Okay.
Bye-bye.